I had my master's degree in counseling psychology, and I was seeing clients, and many of them who were being referred, I had physical problems. I could not understand why I couldn't treat those problems as long as they were with their full physician and there was no conflict, that they weren't trading off what they were doing with the physician for what they were doing with me. And so in a very short period of time, within, I would say, a year to 2 years, many people were coming with diseases, including cancer, tumors, other various diseases. And I was showing them, because of my history with the monastery and meditation, I was showing them how they could apply meditation to their problems and reduce their troubles and reduce their symptoms. What began to happen was the symptoms reduction turned into remission with many diseases, especially cancer. Leukemia, stomach cancer, breast cancer, brain tumors were going into remission. There were several very powerful cases. One is of a doctor of psychology who came to me with a brain tumor, a chromophobic tumor on her pituitary gland. And it was about the size of 13 millimeters. It was a very big tumor. Mayo Clinic told her to get her affairs in order and return for surgery, which they do by lifting the lip, upper lip, and going through the nose into the brain. She had 2 weeks to get her affairs in order. She came to me and said, "What can we do?" And I said, "We can get rid of this tumor." I said it because I knew that she was going to have surgery. I said, "We can get rid of this tumor, or we can shrink it." And she said, "I want to do it." "Can we do it in that time?" I said, "I don't know, but we can begin." And so we did. By the time she got back to the Mayo Clinic in Rochester, Minnesota, and they re-diagnosed her in preparation for the surgery, they said, "Whoa, the tumor has reduced down to 3 millimeters in size. Whatever you're doing, keep doing it, whatever's going on." There were cases like that of people that were in real trouble. So I continued to do that kind of work, not just psychotherapy, which I was trained to do and was doing, but I was doing healing using mind over matter. It wasn't unheard of. There were other people in this world thinking that way and perhaps doing it, but the Chicago Tribune got hold of it and did an article on it. Then my practice grew even more, and people were coming with diseases, and they were going into remission, especially soft tissue diseases like cancer and breast and cancer in stomach and so forth. These kinds of things were going. Things that required, I wasn't fixing bones. I wasn't healing bones, although I know that bones were healing faster than usual. So medicine, I was coupling and combining my work with medicine and collaborating with physicians on this. We were calling it holistic health.
How did you know that you were able to heal through meditation, and what did you do?
I knew that deep relaxation, reduction in stress is another way of saying it, was very beneficial for the system. What I was doing was guiding people in deep relaxation meditation on the one hand, getting them very, very deeply relaxed, and then suggesting to them we could say almost hypnotically within the meditative, guided meditation, suggesting to them that their disease, which I was having them picture in their mind, was diminishing, was falling away. At first it was being destroyed. But as the practice went on, I learned more. I learned a better way of doing it, and I learned that if the system would reabsorb these out-of-control cancer cells, the disease would go away more quickly. So that's what I did. I would guide them in meditation where I would have them reabsorb, visualize, reabsorbing these cancer cells into their system and flushing them through their immune system and through the lymphatic system out of the body.
What's the science behind that? How does the mind over matter work exactly?
There is no difference between the mind and the body, just as there's no difference between you and me, as I suggested before. The mind and the body are one, and so we began to discover how that happened in 1984, when the then director of the National Institutes of Mental Health, named Candace Pert, Dr. Candace Pert, and her colleagues discovered that these things called neurotransmitters would come into being with a single thought and would travel all over the body at 225 miles an hour, communicating to every last cell in the body, including immune cells. So after the fact, by 1984, we then had the science between what I was already doing. So to make a suggestion and go like that disturbed even the little dog here sitting with us. It's a disturbance. It's a stressor. And it represents the first stage of stress, alarm. There are 3 stages of stress. Alarm being the first. That alarm generates cortisol, norepinephrine, adrenal fluids that pour into the bloodstream and create trouble. Neurotransmitters are also running around all over the body saying, we're in trouble, we're in trouble, we're in trouble. Just because of that, the little dog jumped again. And those chemicals take a long time to exit the body. They are stressors, and they're inflammatory, and they are behind promoting these cancers, along with genetic proclivity. So once I learned that, I was flying because I could say to people, here's the chemistry behind what we're doing, and it works. And so I continued to do that with lots of diseases, and then along came me with prostate cancer. And my physician said, you have an aggressive form of it. It's in 2 places in your prostate, so the prostate has to come out, and I want to do the surgery as soon as possible. And I said no, and I went to University of California, San Francisco, and got diagnosed by the then vice chair of urology, and Dr. Christopher Kane, and he said to me, that prostate has cancer and it's got to come out before it metastasizes into your body and gets all over the place. That was in March of 2008. And he said, let's do it now. And I said, no, I would like to do it in July. Now, he knew the work I did, this doctor. And he said, July. Why July? And then he answered his own question. He said, oh, I know what you want to do. I know what you're going to do. Okay, if you want to risk it, July. So we set up a date for surgery in July. And by the time I went back for my pre-op in July, when they did another ultrasound, and they did another biopsy, and there was no cancer. None. So that's another example where I had my first opportunity to use these techniques on myself.
Were you scared?
No, not at all. Don't misunderstand me when I say use these techniques on myself as if these things work for anybody. They don't. They work for me. And because I was a long-time monk and had studied consciousness for a long time, I really understood why they worked for me. And they would work for certain other people too. I do not have a belief that they work. I do not suspect that they work. I am certain that they work. And that certainty communicates itself to the patient. And they get infected with that certainty along with me, and they make the changes. I find that it doesn't work with people who doubt. I am well aware that that power then is translated into neurotransmitter movement, and that the cells are hearing, we're getting better, we're getting rid of this disease, and they and the immune system do their work. The killer T cells and the macrophages all do their work, and they get in there and they clean up the mess. I am also aware that there are others who can do this in varying degrees. Some can do it very well, they're good healers, some can't do it at all. It depends on how much they believe. So what I do is, with patients, is I ask them to read, before I work with them on any cancers or any diseases, I ask them to read a book by Deepak Chopra, Dr. Deepak Chopra, a physician, called Quantum Healing. Because in the book, he rather nicely talks about how this mind-body connection works. I don't do it so much to teach people about it. I want to know whether they can believe that this is possible. And if they come back and tell me this book is fascinating and wonderful, I will work with them. If they doubt it, I will not go into doing healing with them. So the guided meditations then are a overlay and a technique that represents getting this momentum, this movement, shall we say, generated in their bodies. I don't give the cancer or anything else any opportunity to grow or have any kind of a chance against what we're doing. I ask them to I will make a tape for them, and I ask them to listen to it at least 2, 3, 4 times a day, just as if they were taking a course of antibiotics. Listen to it. Do it over and over. That's what I did in the time that I had between March and July, which was way plenty of time. So I see what I'm doing as the best kind of chemotherapy, because it really is changing the chemistry. I can do it with a clap of the hands, and the chemistry changes in everybody who's within earshot. I could give a gesture, a naughty gesture to somebody, and the chemistry changes in their body. For the worse. Why can I not change that chemistry or help people change their own chemistry for the better? So I'm not just believing that this is good and this is so. It's a certainty, and I'm doing it every day that I work with people. And it can be done by others as well. The problem is their doubt. Whether it's the practitioner or the client patient or both, it's their doubt. So this is how meditation then, as simple and gentle as it is, and as designed as it is for a path to enlightenment, can be used to make people's life better and even heal them.
Do you want to just talk about your last experience with your heart?
About 3 months ago, I had come back from a long jog up and down a mountain, and I was sitting in meditation, and I'd been in that meditation maybe 3 to 5 minutes, very calm, and all of a sudden I felt this pressure in my chest It was like nothing I'd ever experienced before in terms of pain. I knew I was having a heart attack. The funny thing is, I've been told by my cardiologist I have no plaque and I have no cholesterol. So it didn't make sense, but I knew it was a heart attack, and I ran to the kitchen and I got an aspirin and jumped it down my throat, and then I got in my car and I drove myself to the hospital, where I just about passed out as I drove into the parking lot. They picked me up and took me in. They did an EKG on me immediately and said, it can't be a heart attack because we've got your records here from Dr. Kahn and you don't have any heart disease. So it must be something else. I said, I'm having a heart attack. Give me Dr. Kahn. So Dr. Kahn was called, and I said, I want you to do an angiogram. You're going to find I had a heart attack. And he said, you can't have had a heart attack. I'm looking at your chart here. Your heart is perfectly normal. I said, I'm having a heart attack. Do the angiogram. He trusts me, and he listened to me, and they did a very expensive angiogram, and they came up with I did have a heart attack. Somehow a blood clot had formed and blocked in my heart and was damaging my heart. So they put me on heavy medication, and I'm supposed to be on this medication the rest of my life. However, within 6 weeks of the heart attack, I went in for a stress test, which is a treadmill, 2.5 hours of stress test and echocardiogram and so forth to come up with a profile of what has happened to the heart and the damage that has been done and how I'm going to be limited. And Dr. Kahn and his colleague looked at those charts after my almost 3 hours there, looked and looked and looked and looked, and finally they came out and sat down and said, don't understand this, don't know what happened, but if we did not know you had a heart attack, we would not know you had a heart attack. Dr. Kahn said, I don't know what it is you're doing, but whatever it is, keep doing it. Well, he does know what I'm doing, because I've done some lectures for Dr. Kahn. But physicians generally do not understand what I'm talking about. Whether they have the capacity or whether they don't want to understand it, it's very difficult, it seems, for them to understand that these things I'm talking to you about right now are possible. And that goes for most patients. They find that this seems to be impossible. But it is not.
How much meditation do you need to do? And can you be a white belt and do this? I mean, do you really need a teacher?
For disease, you need a guide through it. Yes, for disease. You can do meditation on your own if you're interested in simply reducing stress and becoming more peaceful. You can do meditation on your own if you keep it up. I find that people tell me that meditation is not working for them, and there are only very few reasons that they would not be working. One reason is a prominent reason, and that is they're lying, they're not meditating. They say they meditate, and they do not. They think because they meditate maybe once a week or so that they're meditating, and that is not meditation. It doesn't give the benefits that they want. Another reason that meditation isn't working is because people are doing the wrong meditation for them. In the 60s, 70s, and 80s, the featured meditation, and the one that all the research was done on, is called transcendental meditation. It's a mantra-type meditation, and all the research was done on that meditation, that form of meditation. Today, especially in the 2000s and beyond, the form of meditation that's being done is different. It's called mindfulness meditation. It is very, very hard to do. I don't need now to go into exactly what the difference is between mindfulness meditation and concentration meditation is like, unless you would like to hear it. You would. Mindfulness meditation has taken off because of the Dalai Lama and other Buddhistic interests that have come west from the Far East. And mindfulness meditation is a form of meditation that permits anything to come into the mind and consciousness, but to pay no attention to it. As if it wasn't even there. And this is a very hard and advanced form of meditation for people to do, and they make no progress in it, or very few make progress in mindfulness. Another form of meditation that is called concentration type meditation, and there are two forms of that, discursive and non-discursive. Concentration meditation is focused on one thing, not on permitting everything to enter, but on one thing. Just as like you are focused on me right now, but you do not see your little doggy or are not aware of your little doggy. Now you are, because it's come into your consciousness. But before that it was just me. That's a kind of concentration meditation. You're meditating on me alone. And practicing that meditation is extremely important and powerful for healing. The ability to stay on point. Within the concentration type meditation, there are two forms of it, discursive and non-discursive. Non-discursive is where there is concentration with no thinking whatsoever, no mentation, no mental activity. Concentration on the point of a flame, or on the cycle of your breath, or on a mantra. The second form of meditations, concentration meditation.
Start again?
Pardon?
Start the sentence again.
The second form of concentration type meditation is discursive meditation. And that form of meditation is more like the guided meditation that I do for people in healing. It's used in religion and theology for changing yourself for the better, like meditating and thinking about the life of Jesus, or thinking about the life of a saint and imitating that saint in your meditation, thinking about how a saint is compassionate, like St. Francis of Assisi, and then imitating that saint and seeing yourself imitate that saint. That's how it's used in religion. Outside of religion, discursive meditation is used for personal growth. Very few people know what I'm talking about, but it is used for personal growth, and almost all of my guided meditation evenings that I do with people, groups of people, are guided type meditations, where I will present a formula for growth and then guide them through that formula for growth. Then after the meditation, they come out of the meditation and we discuss it and then try to apply it even further. So there's a lot of opportunity for growth in guided meditation, discursive meditation. To delineate a little bit further these kinds of meditation, I can talk about Dr. Herbert Benson, who is a researcher from Harvard University that did some meditation on research during the 1960s. He wrote a book called The Relaxation Response, which is also required reading for my clients and patients who are wanting to do healing. Dr. Benson, as a Harvard professor, got interested in what meditation was like and what good it was. So he went to the Far East to study meditators, adept meditators, because there weren't really any adept meditators in the West. So he went to the Far East and he studied both Tibetan Buddhist meditation, which is mindfulness kind of meditation, and he studied yoga type meditation, which is concentration type meditation. What he did in these experiments is he got adepts in both yogis and Tibetan Buddhists, and he separated them out, and he put the Tibetan Buddhists in one place and the yogis in another place at a different time. He wired them up with EEGs and EKGs, and he had them go into meditation. And when he had the yogi type, concentration type meditators in meditation, he surprised them with a gunshot. He blew a gun off in their presence that would have caused anyone else to explode, to react, to jump. These meditators, these adepts, these proficient yogi meditators never flinched, and their EEGs continued in alpha, alpha, alpha waves, alpha waves, alpha waves, alpha waves. Nothing changed. Their chemistry did not change either. They were not even aware of the gunshot. When he did the same thing with the Tibetan monks, who were mindfulness meditators, their EEGs continued in alpha, and when the gun went off, it spiked up into gamma, very, very intense, and then dropped directly back down to alpha and continued alpha wave shooting, alpha, alpha, alpha. And you'll only really find alpha in meditation, alpha waves. Their blood chemistry did the same thing. Steep dips. If I shot a gun off here, or I just clap my hands loudly, like that, everybody in the room, including the little doggy, will have a dump of chemicals in their blood, and it will continue to taper off for a long period of time, 20 to 30 minutes, maybe longer before that all dissipates. Meanwhile, that's inflammation in their bloodstream. It is not conducive to health or relaxation at all. So what Dr. Benson found was meditation was intensely beneficial for health, mental and physical health. And so we're using some of the research now. I certainly use the research because it's required reading along with quantum healing before I will work with anybody who has disease. If they can understand these principles, I've got a great shot at them healing what they've got, what they're bringing in.